Hello everyone, welcome to my corner again. This is the third video of our health insurance series, and I'm going to go into a little more depth on this video. We'll probably talk a little longer. Instead of having these shorter tidbit videos, I decided to go into a little more detail, share more information. So, we talked about Medicare in the first video. It was an overview. We didn't go into deep detail. You should talk to your insurance agent in terms of more detail regards to Medicare. Then I mentioned on the second video, FSA plans and HSA plans are available for the high deductible plans, whether they are Medicare replacements or whether they are straight up commercial plans. And what I mean by commercial plans, I'm talking of the popular ones that everybody hears. If your employer offers a health benefit, you will be one of those plans offered. Now, interestingly enough, when it comes to eye care, we know that sometimes, actually more often, when it's offered, a vision benefit will be a vision plan, or some of you call it eye insurance. Now here's the interesting thing. There are some health insurance plans that already offer routine vision and testing included with it. They give you an allowance, $100, $200, $300, whatever your employer agrees with, and that allowance can be used towards the exam. It can be used towards the materials, glasses, contacts. And some of these plans even include diagnostic testing, like a visual field test or a fundus photo, which is a picture we take of the inside of the eye. Depending on the camera being used, I believe we can get more information than the typical dilated eye exam. This is part of your health insurance, and it's a routine vision benefit. It's not eye insurance. It's part of your health insurance because those plans take into account the health portion of the eye. The great majority of plans do not offer this routine vision benefit. Please make sure you ask if your plan includes a routine vision benefit, because it's easier to work with the doctor when you have those. Okay, health insurance. When it comes to eye care, what situations, what circumstances would I require your health insurance information? If something hit you in the eye and I have to look at it, I would use your health insurance benefit. If something hit you in the eye and it's lodged on your cornea or the white portion of your eye, I would use your health insurance. If we're monitoring glaucoma, if we're monitoring diabetes, if we're monitoring certain medications that have a possible vision impairment factor as a side effect, like hydroxychloroquine, also known as Plaquenil, that would be billed under your health insurance. Anything that has a medical nature, that changes the anatomy of your eyes, the physiology of your eyes, that could leave a scar as a result of injury or some sort of treatment, we would bill that to your medical insurance, not the vision. Those circumstances I just used as examples are health conditions that happen to be on your eyes, okay, or within your eyes. Now, vision plan, how do they work? This is what they do. They charge you a very small premium amount, okay? I even have some patients get super excited that they don't charge anything. They only pay for the health portion. The vision and dental are included. Based on how I've seen vision insurance work, there's actually a better chance those patients who pay nothing, there is no free lunch people, you've heard me say this before, are most likely paying more than the patients who know how much they're paying, even if it's a small amount. There is some variation. Some patients pay $7 every paycheck. Some patients pay $30 every paycheck. It varies. It changes the level of coverage you have. But the gist of the plan is this. You pay the small premium, okay, once or twice a month. You come to the eye doctor. You expect to pay $0 as a copay or $10 as a copay. Now, I'm going to raise a question here. How long do you think the doctor is going to want to spend with you if you're only paying $10 for their time, knowledge, and expertise? Think about that. All right, now continue. $10 copay. That's what we see most of the time. Then we do the exam. Hopefully you have an awesome experience. And then we go to the optical boutique area or the dispensary. You pick your frames. You learn about what lens features the doctor recommended. Hopefully they did tell you what they recommended, and you understand why we're recommending what we recommend. And then it's time to go over the benefits. And the optician or the sales associate does a great job at explaining the detail. Now, is it complicated to understand? You betcha. Is it on purpose? I would like to say so, because most patients don't understand what's going on with their benefit. Sometimes we have a difficult time translating what's going on with their benefits. Now, the optician shows you the paper. They go over each of the benefits that the vision plan offers. Keep in mind, I keep not calling it vision insurance on purpose, and you understand why in a second. So they go over the detail, and as the patient you go, wait, what? Why is there an out-of-pocket? Why didn't it cover everything? And then the sales associate has to explain, well, they give you this much to cover a frame, okay, unless it's their frame. They cover their frame 100%. But if the doctor happens not to have their frame because they don't necessarily believe in the quality of the product, then you have to pay the difference. Same with the lenses. They will cover certain lenses or certain features. If you need something different because of your prescription, because of things you were complaining about during the exam, they will only cover a portion of it. You're responsible for the difference. And this is the gist of it. So, if you took the time to add up what you pay for your premiums each month, and then you add the copay, you would find out that very closely, okay, I won't say it's on every case, but what you paid those 2 years, because many plans don't allow you to get a new frame every year. So what you pay for those 2 years will add up to the amount of discount they're giving you. So is it really a discount? Are you really getting a deal? Or is it just a savings account? A really bad savings account. Because then you're left with all of this money that you have to spend in a big chunk. And it makes it a little more complicated to come back every year like you're supposed to, especially if you have children. It gets tricky. It's something that you feel like you're getting a good deal, but in the end, you don't really. Keep that in mind. So that's why it's not insurance. Health insurance is set up in a different way. As much as there are things we don't like about how health insurance is set up here in the United States, it's not as predatory as the way the vision plans are set up. Now here's an interesting thing. Let's say, as a doctor, I own my own clinic. You would think I have control over what I charge, right? But there are two factors that determine why glasses cost what they do. First, we have to blame the corporations who make the majority. It's actually one corporation who manufactures the majority of the frames. They dictate their profit margin. They charge large prices for us to sell them in our optical. And of course, they act like they're, trying to help us, give you good products. It's not real. It's not necessarily true. So we have that factor. The other factor has to do with those vision plans. There are plans that specifically dictate on the contract that I have to sign with them that if I charge or if I give a discount greater than 20% to any patient, whether they have a vision plan or not, they will come after me. I am not allowed to do that, but it's my practice. You see how it's paradoxical, it's controversial. So things would actually be simpler if I could do business directly with you. But I know, and again, I'm not trying to say you need to give up your health insurance. We never know when we're going to have an emergency. You know, you try to decide based on the health level of your family, what kind of plan best fits your category. In fact, I'll do a little side note here. I didn't even talk about health share plans. They're not insurance, but they are a decent alternative to insurance if you fit the criteria they establish. There are a number of them out there. They usually have some sort of religious requirements, attendance to church of a certain belief, and those who are members within the plan, you pay a monthly fee, and the monthly fee goes into a big pool. Now, let's say my wife needs to go to the doctor, and there is some testing that needs to be performed. We will pay the cash price. We do not pay the insurance price. And then we send the receipt to the folks who manage the health share plan. And we get reimbursed for the cost as long as it meets the criteria established. And patients are usually successful in getting refunded, no matter the cost, okay? I know of a individual where she had to spend a few days in the hospital, a day or two in the ICU. Her bill was in the thousands of dollars. They refunded them every single dime of that hospital stay. So it is an option. If you don't have the ability to get health insurance from an employer, these health share plans are an option. If you have questions, you can ask them in the comments, and I'll private message you some more information, guide you in that direction. Now, let's go back to the vision plans. So, like I said, I would have better control. I would likely be able to charge less on my materials, glasses, contact lenses, specialty contact lenses, if I didn't have to deal with those vision plans. If I could do directly with the patients, okay? Remember the copay, the $10? So I went to school for 8 years total. Doesn't it seem that $10 for 30 minutes of my time, it's a little too little? If you want good quality, if you want all of my knowledge, all of my attention. So that's why another interesting aspect of eye care is you have clinics like mine where I'm the doctor, I dictate things. I'm not owned by a big corporation. Okay, so I set how long I need to spend with my patients based on how complicated their situation is. Young, old, I determine how my schedule flows. When you go to what I like to call a doc-in-a-box place, okay, the big box stores, their focus is to sell glasses. It's not what's necessarily best for you. And it's not the doctor's fault. We have the same training, but the corporation dictates the schedule. The doctor works as an independent contractor. They happen to be within the store. They generate a prescription, and then the sales associates try to sell you their glasses, okay? One interesting thing, I can say this because I used to be in that kind of setting for a few months before I took over my practice. Not very many people walk out of there with those amazing deals for 2 glasses, okay? And it's usually because the deal focuses on their heaviest, ugliest, harder to sell frame, and the lens features are the very, 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 very basic. So if you have a prescription that's stronger than 4, for example, you don't qualify for that. If you're a child and we need to give you impact resistant lenses, you don't, well, actually, I'll go back. They do offer it to children. That's one nice thing. But if you're an adult and you want to have the impact resistant lenses, you're not going to get that amazing deal that you see on TV. Not very many people walk out of there with the amazing deal, and in the end you might even spend more than what you would have spent if you saw an independent doctor, because we have control over specials, promotions. Plus, you need to understand the concept of value. Yes, price is important, but you also need to think about the level of service, the quality of materials that you're getting for what you're paying for. I had a patient today. She told me, yeah, doc, you get what you pay for. Okay, whether we're talking about big box stores, whether we're talking about buying things online, we assign value to different things in life. For some people, it's very important to have lots of shoes. For some people, it's important to be healthy or see as clear as they can. Vision is a tricky thing. You don't know until you get behind the machine if you have perfect vision. And you might think that, oh, but you're the eye doctor, you want to sell glasses, you're going to tell everybody that they don't see well. No, it's not the case. I did not choose to be in this profession just to sell glasses, to be a salesperson. My focus is to improve people's quality of life through their vision. And I know there are even the doctors who work for corporations, okay, who work retail. That's their focus. They don't have as much control as I have because they have to follow the corporate rules. They have to see 6 patients an hour because that's how they schedule their appointments. And that's why your visit is so short with them. Okay, they are limited in what they can do. I have more control over how I practice. And that's why I decided to practice in a private setting. So if you have the chance to sign up for Vision Plan, I would say you're better off opening a savings account and putting your money into the savings account. And as you accumulate the amount that is needed for what you want and what you need, what I deem necessary for you to see clear and comfortable, you go to the doctor's office and say, Doc, what's your cash price? What promotion do you have going on? And you'll be amazed at how you're going to save more than if you're using the Vision Plan. One point I did not mention yet, they actually also, in a way, restrict what products I can choose for you. They try to encourage me to sell. And this is an interesting situation. So the company owns the Vision Plan. They also own the lab, and they force me as much as they can to use their lab to make the lenses, to make their brand of lenses. And they encourage me as much as possible to use their frames. If they could, but they can't, I'm independent, but they want you to go to the stores they own, and they create this monopoly. When you think about it, who's really benefiting from you as the consumer utilizing a service that, let's be honest, for what we pay for, because I pay for them too when I sign up with them, what are they doing? What amazing service are they doing? All they're saying is, oh yeah, patient, you want to go see the doctor? Yeah, they're in network, you can go see them. No, that should be like $2. It's insane the way it's set up, okay? Like I said, open a savings account or look for a doctor who has an in-house plan. I've been working for the last 2 years on promotions, on ways to reduce the cost within my practice, to be able to help more people. And I decided actually recently, instead of catering to and nothing against people who choose to keep the Vision Plan. It's not my intention. I'm not coming after you. But I see so many people who would like to come see me, who don't have access to vision or health insurance, and they feel like they're forced to go to a commercial place because I'm going to be too expensive. And I'm frankly tired of it. So I am working. I don't have the details yet, but I am working on setting up a system within my practice where I can benefit everybody in a fair way. Insurance, no insurance. This is our video for today. I know I went a little longer, but I did it on purpose, like I said at the beginning. Please share this information with your family and friends. Leave me comments. Ask questions. I will be happy to discuss things in more detail with you. That's the purpose of this channel. I want you to be better informed so you can be a better consumer, better equipped to take better care of yourselves. Okay? Watch out for the next video. I will continue to post them. My hope is to post them every Thursday, once a week. Now, I run a business. There might be a week here and there that I might skip it. But I'll do my best to stay consistent and continue subscribing. Please like our videos and look at our social media link. Follow us. Stay in touch as I continue to introduce more ways, if you live local, close to where I am, as I introduce more ways to help you get better care, better value for less money. Stay healthy. See you around. Take care.